The following program is a specialty program. Unless otherwise identified, the participants on the program are not employees of Chorus Entertainment. Opinions expressed may not necessarily reflect the views and policies of Global News Radio 640 Toronto.
All right. 6 minutes after 11 o'clock in the morning on a Saturday. It's going to be a beauty. So, again, the prescription for today is get out there and enjoy it. Get moving, enjoy this weather and this summertime for sure. You want to call in, you have questions about your own personal health, bring it on. That's why we are here every week doing this show. Again, 416-870-6400, live on the air. Your phone calls make it that much more interesting. Sometimes the question you ask is a question that maybe hundreds, if not thousands, of other people have in their mind as well, but maybe a little too bashful to call. 416-870-6400. You want to reach out, info@pinpointhealth.ca. The clinic's always growing. They are open, as you know. They're serving people. They're helping people. You just got to make that first step. Dr. Lou, good morning, brother. How are you?
Good morning, John. I'm doing well. How are you doing?
Excellent. Ready to roll. What's on the docket for today?
Well, you know, I always love the way you start the show because it always will jog my mind and make me think of something. And you just said there, the prescription of the day is get out there and move. And it's interesting. Part of what I do as a chiropractor, musculoskeletal health expert, and chronic pain sort of person is people often ask me about posture. And there's always people will come in and they'll say, I know I have bad posture. Or they'll come in and say, what is the better posture for me to be in? And there's a lot of, and I knew this intuitively just based on my own injuries and stuff, but there's a lot of emerging research that's actually starting to show what I've been talking about for years with patients, which is no posture is really ideal for any long-term period of time. Really what it comes down to is our bodies are very much meant to be moving. We're not meant to, I don't care what the posture is, right? Like people say, well, I work at a desk and I try to sit up straight. Well, that doesn't matter. Your body will fatigue. It's inevitable that it doesn't matter what the posture is. It's going to fatigue. The biggest thing that people can do with posture is change as often as possible. A lot of research is starting to show that it almost doesn't matter what your posture is. Where there's an increased risk of injury is if you're in any one of them for way too long. And most people sort of know, you sit there for a while, you could be in a night. And I challenge anybody, go sit in at your desk chair right now or at your kitchen table, wherever you might be, or you're in your car listening, whatever, and sit up straight and let me know how long you can do that for. It's impossible to do it constantly because your body is going to fatigue. That's just what's going to happen. Some of the muscles that you have to use in order to do that upright posture that's often sold as good posture takes a lot of extra muscles that aren't necessarily postural muscles, which will make you fatigue. Now, what I'm saying here is not that there isn't ideal postures over others, right? Like we can all, I think everyone can appreciate that if you're slouching and in a really horrible type of position, and that's probably not as good as being in a more of a neutral position. Yes, 100%. But what I'm saying is none of them are going to be good long term. You have to move, and that's why I'm saying, John, you always jog my mind with stuff because this was a conversation that I was having with a number of colleagues this week. We were talking about some of the latest evidence around posture, and again, it's starting to show exactly what I've been telling people for years is don't focus too much on any one good posture. Get out and move and do things. I have employers that will call me and, make me go to their workplaces. This before COVID times, obviously not as much during COVID, but where employers want to know what is it that, my employees could be doing to be in better postures and, what types of chairs. And I always say the same thing. It's like, we can get some better stuff for sure. We can definitely make it more ergonomic. But the reality is if they're not moving around, if they're not building in breaks, if they're not changing the environment, then it doesn't almost matter what we give them. They're going to sustain injury because it's just prolonged. We as human beings are not meant to be in static postures. I don't care if one is more neutral than one would be considered more bad, but there's going to be a certain amount of time we could be in that. And the reality is we've got to move around. And we naturally do that, right? Like a lot of people will say, well, I toss and turn in my sleep. Well, your body naturally does that, right? Like you've got to move around. You don't want to be in any static posture for any prolonged period of time. So I think that's a really important conversation because I think sometimes number one, there's a lot of gimmicks out there which sell you on, buying this thing to keep you in an ideal posture as a way of reducing injury or whatever it may be. And again, I say the same thing to people. It might be something beneficial for a period of time that you can use to help. But the reality for injury prevention and for taking care of our bodies when we're in these prolonged positions, sitting at a desk, whatever it may be, is building in breaks and changing what you're doing every, 15 to 20 minutes. And again, that doesn't mean that if you're sitting for 15 minutes, well, you've got to be standing for 20 minutes. It's about offsetting, right? Like it's about it within those 20 minutes while you are sitting, maybe you're sitting back into the chair for a few minutes, then you're coming to the front and you're sitting on the edge of it. Maybe you're standing up and taking a 1 or 2 minute break that way. It's very easy to build in this change without making this, it doesn't have to be as didactic as saying it's 20 minutes of this and 20 minutes of that. It's just about changing. You've got to constantly change the posture overall, and it doesn't matter really what you're doing in order to prevent injury.
All right, 11:16. We are back. I assume you can hear me now, Dr. Lou. That'd be really good.
Yes.
Good.
Sorry, John.
We're at the mercy of technology. 416-870-6400 is the way to call through. I was just commenting on your last comment about, ergonomics in the office and sitting around. I said it's kind of a catch-22. You go out and you spend all kinds of money on expensive office furniture, and then you kind of get comfortable. You don't want to get up and move around. And I think this is one of the offshoots of people working at home for so long. Maybe they are not getting up as much. Maybe they're spending more time at the dining room table and not moving around. I think we're starting to see that, right?
Yeah, and listen, I guess where the point I'm trying to get across is the point that I constantly try to get across, where it's about finding the hybrid, right? Like I'm not suggesting that the stuff that is designed for offices doesn't put us in better postures or more ideal postures. Of course, there are more ideal postures and less ideal postures, right? Like I think everyone can appreciate that. What the research is showing, though, is that none of those for a long period of time are good. And that's the point I'm trying to make. So it is a combination of having the right hardware, the right things for an office space, but it's also a combination of doing the right things, right? And this goes back to sort of, the point that I try to make week in and week out where, as humans, we are naturally designed to conserve energy, right? Like that's what humans want to do. If we could do something and find the simplest way possible to do it from an evolutionary perspective, we're going to do that. And we see that with everything, right? Like, once upon a time, if you wanted to change the channels on the TV, you had to walk up to the TV. Now you're at the point you can do it off your phone, right? So we're always looking for ways to make things easier and easier. And that's a good thing. But I think it carries into parts of our being that aren't necessarily healthy for us. And an example of that, and something that I get asked a lot, is, a lot of people will reach out and talk about, say, something like weight loss. And they want to know, well, is there, people have heard acupuncture, as an example, might be beneficial for weight loss. And they know our clinics do acupuncture, so they'll call us for that. And, the advice is always the same. It's like, well, what are you looking for? Are you looking for acupuncture to be the silver bullet, or are you on a weight loss journey and you're stagnated and you're looking for a little bit of a kick, something else that you can be adding in? And it's incredible how the majority of people will say, well, I'm not doing anything else. I just heard that could help and I want to try that. And it's like, well, why would you want to try? Number one, it's not going to work. And number two, I don't think it's groundbreaking anymore for anyone to accept that weight loss takes determination and willpower in terms of healthy eating, caloric restriction, and exercise. And if you do those things, you'll lose weight. And most people fail because of the other, it's hard work to do that. And so they're looking for the simpler way. We see this in pain management, right, where most people want a passive intervention. And again, something else that I talk about week in and week out, where it's really, especially when things are becoming chronic, what we're looking at is to focus on the active care. What is it that you can be doing for yourself? What exercises, stretches, what things every single day can you be doing? And there's a lot of them. I'm only mentioning two quick things there, but so many people want passive intervention. They want, well, I'm looking for someone to do this procedure or push on my back this way or give me this pill because it's simpler. Right. And as long and this carries on to the point that I'm trying to make in the office setting. Right. It's easier to just say, well, give me a better chair. I don't really want to think about doing exercises at my desk or different types of movement patterns or building in breaks. It's just easier to say, is there something else that can do the hard work for me? But I guess what I'm trying to say, when we look at health, what we see very much over and over and over again is you are more likely to achieve health if you're a participant in that. You can't just be a bystander. And the healthiest people in the world that you can see will tell you they work at it, right? It's not something that it's a combination of willpower, doing the right things, whatever. But you've got to be part of it. Just relying on different tools, different procedures, whatever it is not going to work. And that's my point. It carries into even something like, how do you minimize the incidence of any type of ache or pain when you're working at a desk for a long period of time? And yeah, we can try thinking, well, maybe we could just get a better chair. And I hear this all the time. Oh, it's my desk, right? Like, I talk to people and they'll come in and they'll complain, and everybody wants to complain. And, it's the employer and it's the desk. And then I start asking, well, what is it that you have? And it ends up being like, well, no, that's actually a pretty good ergonomical setup. Do you take any breaks? Well, no. Okay, well, do you do any exercise after work? Well, no. Do you do any rehab type of activities for the ache or pain that you have? No. And again, it's so easy for humans. Another human tendency is it's always easier to blame others or other things for our problems and take credit for the things that are good, right? And that's constantly what we see even in pain and injury management, is people often want to blame everything else before they want to look at, okay, well, what is it that I could be doing? And this is the part about me that I think people appreciate, the real talk. And some people maybe think it's a bit of a hard line, but I talk this way because that's really the reality of it. That's what the research shows, clinician experience shows. It's evidence-based to look at it this way.
416-870-6400. You still have lots of time for some personal issues, some musculoskeletal issues, whatever it is. Give us a call this morning. That's why Dr. Lou is here live answering your calls. 416-870-6400. It's so true what you say. You almost wish you could give people a shake and say, you're at the starting point here. There's the end point where you want to be. Don't be hyper-focused on being there. There's no magic pill. There's no way to jettison yourself to that point. That goes with your health. That goes with your fitness, your weight, building financial freedom, all that stuff. Try to get people to enjoy the journey there. That's the part where they'll really be successful, because most people, they don't want to put in the hard work, and they don't see how they can put in the hard work and eventually get there. I mean, how do you train people to think that way? And that includes coming back from injury as well.
Yeah, I mean, you're absolutely right. It's something that ties into so many different aspects of life, even outside of what I'm an expert on. You mentioned things there like creating wealth and business success and whatever else, and that's definitely not my area of expertise. But how do you build? It's nice. Some people come in and they have that already. They know that they have to be the participant in their health. They appreciate that because they're already that way. I think a lot of these things, it's transferability in different areas of your life. If you're a certain way in one aspect of your life, it's that way in another aspect of your life. And so some people are just naturally this way, which is great. Some people are their own worst enemies. And I could tell you, and again, this is a very hard line type of thing that I'll say, but I could tell after 2 minutes of a conversation with a patient who is a patient that will never do well with anybody, because it's the way they're perceiving it. It's the way they want to go about it. It's their disposition. And I know right then and there, like, you are your own worst enemy. And I never say something like that to somebody, but I can tell you I know that this is the person. It doesn't matter who they see. It doesn't matter if they see me or the top doctors in the world, whatever. It doesn't matter who else is part of that. They're setting themselves up for failure because of their thought process. And how can you change that? Like anything in life, number one, it's about someone, either you realizing it on your own or someone else bringing it to your attention. And it's an interesting thing, John. A lot of people will bring their loved ones to me who they know are this way, who know, they're their own worst enemy, and they'll bring them to me and sort of sit there waiting for me to bring this up. And then the minute I start saying things like, your disposition or whatever, and they're like, see, I told you, that that they're there because they're bringing them because someone else in their life has seen it. So I think step one is the recognition of that, whether it's from you yourself, if you're that way, or if you know someone that you love, that you care about, a family member that you know is that way. Sometimes, again, you have to bring this stuff up to them and say, hey, you might be your own worst enemy in this right now. You're the way you're thinking about this. So number one is like sort of the recognition of this. And then, the source sounds like the 12-step program, but it's the recognition. Then it's the individual has to come to the acceptance of saying, yeah, you know what, I am that way and I need to change that. And then it's the hard work to change like that. And I tell people that you're never going to change over a day, over a few hours, a few days, a few weeks, a few months. These patterns, these habits are ingrained in a lot of the times your experience, your life experiences. So many things make you that way. It could take years to change someone in their way, their belief. But I could tell you something that if you aim to steal sort of, Greg Wells, who we've had on the show before, who's an author and exercise physiologist, where he talks about be 1% better every single day.
Awesome.
I think that's a very realistic goal for people. If you can challenge someone to say, hey, I'm not looking for you to go, 180 degrees here. I'm looking for you to go 1 degree at a time. I just want you to be 1% better tomorrow than you were today. And then for the day after, try to aim for that. And I think if we could take it slow and steady, that is really what wins, the race in health.
416-870-6400 is a way to call through. Want to get to our first call for today. And Kim, thank you so much for standing by for a moment. Good morning. How are you?
Good morning. I'm doing great. How are you?
Excellent. What's on your mind?
Well, I just happened to turn the channel, and I'm listening to the doctor, and I want to say thank you very much for being extremely candid. And go ahead.
John, I missed. Yep. I don't know. I didn't hear anything there.
I didn't either. Kim, want to try it again? You dropped out there.
Oh, can you hear me now?
Yes, we can. Try it again.
Okay. Yeah, sorry about that. Yeah, so I'd like to thank the doctor for being extremely candid, and it's very much resonating with me. I have fibromyalgia, degenerative disc disease, and overweight and suffering from depression, and the battle is real, and the struggle is real, and I do resonate with the folks that think that a magic pill is going to help me get out of this funk. And I really like what you just said about even if I do something 1% every day, then if I keep focusing on that. But I do find that with the fibromyalgia, it seems that as soon as I get to a certain point and I have a good rhythm, something knocks me back down again. And it's that much harder to get back up again.
Yeah. And Kim, number one, thank you for calling. And number two, I can totally appreciate everything you're going through for a number of reasons. Number one, it's primarily what I deal with is patients like you. I also have a component of this stuff myself where I have chronic aches and pains. So I know this from a personal side and also from, my job, from what I do. So I know you're absolutely right. The struggle is real. It's not easy. A lot of people on the other side that don't know what you're going through or don't work in this area. One of the things with people would say something like fibromyalgia, and John, this is an important thing for a lot of listeners, and I'm sure Kim will totally resonate with this. A lot of times people that have this type of disease going on, overall their function is almost perfect. Like if you looked at them, you would never say, well, they look crippled, right? Like they're not in that kind of shape, right? They can do everything, they can move around, they can bend, they can do, but they have pain, right? And so a lot of people don't seem to understand there's this lack of awareness that pain doesn't necessarily mean function. Those are two different things. And so that's a challenge just in and of itself, where you have people around you who sort of sit there and say, well, you do everything and you look totally fine to me, but, you keep complaining about pain. And that's because those are two different things, right? There's the biomechanics of your body, but then there's also the pain perception that happens in the brain. Those are two totally different parts of the body, and they don't necessarily have to coincide with one another. So there's number one, that challenge. But Kim, I'm not sure if you have a specific question, but I guess what you're bringing up is something that is very real for most people suffering with any type of chronic ache or pain, fibromyalgia, whatever it may be, is that some days are good, some stretches are good, you seem like you're doing better, then you fall behind because something happens. The reality of that, and and again, this is sort of goes back to, I think, that the education around chronic pain hasn't been delivered in the right way. And one of the analogies that I'll often use is diabetes. If you were diagnosed with diabetes, as an example, you would have the same sort of type of experience where you would say, well, I go certain days, weeks, I'm totally fine, but then, something happens and I'm not so great, and then I get back on and I'm good. That's the reality of healthcare and management of issues. And the unfortunate part that sort of gets sold because, number one, it's gimmicky and it can make a lot of money, and especially for pain and injury, because you see it on TV, you hear it on radio all the time where there's all these gimmicks like, hey, do this thing and cure your pain, get rid of it. And that sort of mentality, that sort of paradigm is actually really bad for this type of issue, because there's this inherent belief that we have that when we're dealing with aches or pains that they should be completely gone and they should go away. And really the reality, and anybody that works in this field will tell you, it's really about management. And that experience that you're having, although it's not great, is the reality of it. There's going to be ups and downs. There's going to be periods where you're much worse, then there's going to be periods where you're better, because unfortunately, to the best that we have available to us right now, and I'm sure in the future generations of medicine, it will progress even further, but we deal within the reality of what we know and what we can do at this point. The reality, the best thing that we have for this type of stuff is management. And management means that you might have some good, you might have some bad. It just all really depends. So I would say stay positive, because it sounds like you're on the right track. You've just got to keep doing it, and you unfortunately will go through those highs and lows.
Kim, appreciate you reaching out and taking the time of your day. You want to reach out, by the way, to have a further conversation with Dr. Lou, 1-855-55 Dr. Lou, DRLOU, info@pinpointhealth.ca. We'll continue Pinpoint Health Show. Just like Kim, you can bring on your calls, ask your questions about your own personal health as well. 416-870-6400, right here, Global News Radio. 11:35, welcome back, Pinpoint Health Show, Global News Radio. Yep, that guy is correct, 416-870-6400. Hey, the purpose of this hour, as it has been for years and years now on the Pinpoint Health Show, not only to educate you about your health, but it's also basically free advice. It's a free consultation for over the hour. You want to call in and ask some specific questions about your health. It is no nonsense replies and no nonsense advice from Dr. Lou. Doesn't sugarcoat stuff, doesn't dance around the issue. He'll tell you straight up what you should be doing, where he thinks he knows you should be heading. And if he can't help you, he'll tell you to go somewhere else. But I mean, that's the whole point of the show. It's going to put you a leg up, no pun intended, on getting your health back in order. So it's a good time to call in. With the remaining time we have in the hour, 416-870-6400. That is how we do it, pinpointhealth.ca, to go online, check some of the clinics that are always expanding near you. They are open, they're in full swing, and they're helping people. But there you go. We're just getting another call lined up here, Dr. Lou. In the meantime, what else you got on your mind?
Yeah, so sort of to continue down the path that Kim brought up, because I think it's a really important thing, and that's something, and we didn't get Kim's reaction back on it, but one of the things with people with chronic pain that they often will say is what I was talking about, that experience where, people just don't believe me because I look fine, but I don't feel fine. And this right now, I'm speaking more, I'm not necessarily speaking to the people who are listening that have this issue, but rather the people who know someone with this issue. You don't discredit that. Don't discredit that although they look fine, that doesn't mean that they can't be in pain. The thing here about pain is a subjective experience that happens in the brain. Our body simply has receptors that tell us what's going on. But the experience of it happens in the brain, and everybody's brain is different. And in fact, the part of the brain that, we experience pain is the limbic system, which also controls our emotions. So this goes back to your life experience, the traumas, the mental traumas that you've had over your life might be related to the amplification of pain in your body. And so that's why different people can experience it in different ways. Everyone can be different. So don't be so quick to judge, I guess, is the point that I want to make on that, is you've got to take that stuff at face value. Of course, there are people, listen, I see it all the time. There are people out there who fake this stuff. Yes, 100%. But as a clinician, I know when that's happening. I can tell. I can do different things to figure out when someone is malingering, as we call it. But a lot of people are not malingering. They simply have a pain experience, although their function may be normal. So don't judge quickly on that. It's more sophisticated than simply saying I believe or I don't believe someone. It's more involved than that.
And, and to your point, the thing that you cannot see, either with your naked eye as someone who's being critical, or for that matter on an MRI or an X-ray, is the mental situation that goes along with chronic pain after years and years. You've often mentioned that it's a cycle. The physical can lead into the mental, and the mental can thereby give you the physical later on. So it's really, really a difficult thing to, as you say, to be judgmental and not take a step back and look and say, maybe this person, I can't see that they're in pain, but maybe mentally this thing has been driving them nuts for years, right?
Absolutely. And you know what? Then there's other people that, to that same point, that are sort of headstrong or maybe in a better mental health position that can deal with pain. And you'll talk to people who say, yeah, but I have back pain. I've had it for 30 years and I'm fine. I do what I have to do. I don't complain. It's like, yeah, that's fine. But this is the reality. We are all individuals and we all experience things differently. So you can't expect that because you do something one way that everyone else will do it that way. And it's a matter of perspective. And that's the lens that I put on when I'm talking to a patient, is I try to have perspective from every avenue that you can look at it. But most importantly, what is the way that they're looking at it? What is the way that they're experiencing? Because that's their reality. Reality is also a very subjective thing, right? That is their reality of their aches and pains and their body. And that's what you've got to, as a clinician, try to hone in on is what is going on with this person. And that individualistic assessment and type of way of looking at it is something that I think is very, very valuable when you're seeing a patient. We can't just treat that, you don't want to look at a diagnosis and say, okay, everybody that has this diagnosis will experience it the same way, because that is definitely not the case. It's definitely not going to happen that way.
416-870-6400, the way to call through and have a discussion, ask your questions. Would love to get you on. This hour is built just for you. In that regard, Peter, thank you for standing by for a moment. How are you?
Oh, I'm doing fine. How are things?
Good, sir. What's your question this morning?
Well, first of all, I'm in the military, and I have no complaints about their treatments as far as treating the injury, but I have deteriorating disc disease in the neck and lower back, osteoarthritis, rheumatoid arthritis. Is there something other than pain management that I could do for this condition?
Yeah. So number one, thanks for your service as a military personnel. Number two, on the front of, is there something? So here's the thing about pain, so let's try to extrapolate what you mean by pain management. Are you just talking about like over-the-counter medication? Because pain management is a multifaceted approach, which includes like dozens and dozens of different things. So can you do more than the general, field of pain management? No, because that's what we do. But if by pain management you mean one thing, then yes, there's probably more. So can you just clarify for me what you mean by pain management?
Okay, well, I've taken everything from Tylenol to Oxy at various stages, and also I've had radio frequency ablation. On both, but it's never lasting. Okay, so you're talking about two different, the pharmacological interventions, and then you're getting into sort of the different types of minimally invasive procedures, the injections, the ablation therapy. Those are two components of pain management, yes, but it's so much greater than that, right? There's diet, lifestyle, exercise, mental health, different types of treatments, those things in conjunction. What I often will tell people that are dealing with chronic aches and pains and chronic issues like yours is it's a combination of all of those things, right? And at some point, it's even a clinician sitting down with someone like you and saying, okay, where is an area that we should be working more? The unfortunate reality about chronic pain, and I have a lot of friends that are in the mental health world, and a lot of them will listen to the show. Sometimes the unfortunate thing that is done with chronic pain, because it's something that we say we feel in our bodies, so much more effort is put towards the physical side of it. Like the pharmacological intervention, the ablation therapies, the rehab, all that stuff. And so often the mental health side of it is completely forgotten and not even a lot of the times addressed. And so it sometimes takes a clinician sitting down with a patient like yourself and saying, okay, where's the biggest, where's the thing that is the biggest contributing factor that we can work on the most? And that's really what you've got to do. You've got to look at this and say, okay, this chronic pain that this individual is experiencing is, 40 or 50% a result of mental health, 20 or 30% a result of biomechanical changes like degenerative disease and stuff, and 20%, or if my math's not adding up there, of deconditioning. And then you've got to say, okay, so we need 50% mental health, we need
30% on the biomechanics, and then we need 20% on the other aspects. So that's what you've got to do. So I can't answer you, I guess, over the phone to say, is there more that you can do? But based on you telling me that you've done 2 classes of what pain management consists of, yes, there's probably a lot more that could be done. And it's hard work, but, if done in the right way and with the right team, the right setting, and with you being on board with doing it, the outcomes are very good.
Okay. I appreciate your answers.
No problem.
Thank you, Peter. Appreciate your time this morning as well. Again, if you want to reach out anytime to Dr. Lou, it's really simple. 1-855-55 Lou. DRLOU is the way you do that. And you can continue on info@pinpointhealth.ca. Info@pinpointhealth.ca. That's not an uncommon thing, that whole description you just went through with Peter. It's very common, as a matter of fact, and sometimes people just don't want to come out and talk about it, do they?
Yeah, it is, unfortunately, right? Like, again, this goes back to the lack of understanding around what chronic pain is, right? And the fact that because most people, we feel the pain in our body, right? We're not saying, oh, it hurts in my brain. We're saying, oh, it hurts in my knee, right, where the problem is. And so much of the effort is only targeted towards the knee, right? But it's so much bigger than that, right? Like, it's about looking at joints that are close by that may have an effect. And as an example, I brought up the knee there, a hinge joint between 2 very mobile joints, the ankle and the hip. And from an engineering and biomechanical perspective, any hinge joint is going to take the brunt of abuse from dysfunction in those mobile segments. So sometimes it's a result of looking at other joints. Sometimes it's, again, the important thing is looking at the mental health side. It's the diagnosis and having chronic pain is multifaceted, the diagnosis of it. And anytime you have a multifaceted diagnosis, what that often tells us is that the approach to help it needs to be multifaceted. And so you've got to do a bunch of different things. It's a lot of hard work. And, some people, there's a couple of problems. One problem that I see is people often aren't told the right things to do. Another problem is people are told, but they don't want to do it, or sometimes a combination of the two. And that's what I mean. You've got to have the right team, the right people that are helping you, but at the same time, you've got to be ready to put in the work yourself too.
416-870-6400. That is the number. You still got some minutes in the remainder of the hour to call through and ask some questions for Dr. Lou. 416-870-6400 and emails info@pinpointhealth.ca. We'll continue. This is the Pinpoint Health Show on a Saturday morning right here, Global News Radio. All right, welcome back. 11:49. Still got some time. A reminder that if you're not in the mood to call in on air and ask Dr. Lou a question, reaching out afterwards is always an option. Always there. 1-855-55 Dr. Lou. DRLOU. Just that simple. PinpointHealth.ca. The websites and info@pinpointhealth.ca. I should mention as well the long form podcast with Dr. Lou. Always interesting stuff on there. You can catch that wherever you get your favorite podcasts. It's called the Lou Down. Check that out at your leisure as well. But you still got some time now. 416-870-6400 is the way to call through to this here radio station for the next few minutes and talk and ask questions. Join the conversation. Dr. Lou, now that we're kind of sort of seeing the end of the tunnel as far as COVID, people, the vaccinations are up, people getting back at it, people getting back out there. Have you noticed, has there been an influx of a certain type of, I wouldn't say injury, but a certain type of issue that has arisen because of COVID over the last year and a half that you're seeing at your clinics?
Yeah, it's a good question. I would say, and I think anybody that works in healthcare has sort of been saying this from last year. I know I've definitely said it on the radio from when this all started that, putting things on hold was going to create a lot of chronic issues, right? Because you're taking things that are happening in acute scenarios that are, acute to begin, going into subacute, and then becoming chronic. So that's really the influx. It almost doesn't matter, what area of the body, but we're seeing a lot more of the chronic issues where people are coming in. And, prior to COVID-19, when I would see a person, the average person would say, oh, I've had this thing. It started bothering me a few weeks ago. I initially didn't do anything about it. And, now I'm here now. And now it's like, hey, I have this thing that started last March and, I didn't do anything about it. I'm here now. That's a big difference. A few weeks compared to a year and a half, that's a significant amount of time that goes by that makes anything that you're dealing with, that much harder to deal with. So that influx of the chronic issues, things that people have been dealing with, that they've been holding off on saying, and again, I've been saying, don't put your health on hold. Don't expect, and I mean, thankfully, we're dealing with aches and pains when we're dealing in my realm of what I deal with at health and what we deal with at PinPoint Health. But people have also put their health on hold for very serious things like heart attacks and strokes, cancers, and we've seen this. There's been lots of news articles that have come out talking about the increased number of things like strokes, heart attacks that are being missed, cancer screenings that have been missed, and people being misdiagnosed or not diagnosed properly. I work in a specialized program for low back pain. There's sometimes you can have medical emergencies like cauda equina. I was talking to the person that runs the program in my area, and was saying that, in the last week or so, there have been 6 people that have been missed for cauda equina by, other healthcare professionals just doing stuff over the phone, not even through video or in person. And that's a huge mismanagement, right? That's a huge mismanagement. I really, listen, I'm all for creating hybrids of anything that make any process of what we do more efficient. And I've said, there's definitely going to be an advantage to having a hybrid system that's not just, hey, come into my office, but if we could do things virtually, it's going to work. But, unfortunately, some healthcare professionals have almost transitioned completely to phones, and I just don't think that's the way that you're going to do justice to a patient, and that's a big problem. And I think there's also an appetite for the average person wants to be seen in person. Like if you've got something going on, you want to go and you want someone to take a look at you and see what's going on. And that's an important aspect of what we've continued to do throughout this time at PinPoint Health. So again, that number one is my thanks goes out to the team who have done this. We've been extremely safe. We've had no real issues that have happened in the last year, and we've again been able to serve our communities and provide these services so that people don't put their health on hold and that they don't have to, that they have that option. And again, if that's resonating with you and you think that sounds like a place that you want to trust for your musculoskeletal injuries, aches, and pains, then by all means, give us a call. We are there to help.
I want to get to Linda in the last few minutes of the show. Hi, Linda. Thanks for standing by, and good morning. How are you?
Morning. Pretty good. Fair to middling.
Good. Thanks for taking the time. What's on your mind?
Well, about May 6th or so, I hyperextended my leg accidentally, and a few days later, as I was icing it, elevating, a few days later, I stepped off the curb, heard a pop. I was in excruciating pain. So since then, I have been icing and elevating. I did get an x-ray. They didn't see anything except a lot of swelling. I just wondered how much exercise I can do without hurting this meniscus or whatever it is further. I have had a meniscus tear on the other leg, and I wondered to know if I could bike, if I can walk. When I do those things, it does hurt, but I'm so anxious to get back to exercise.
Yeah, listen, it's a good question. It's unfortunately not a question that I could properly answer, not having seen you, right? This sort of goes back to what I was saying about the telephone stuff. I don't know, right? This is the art of seeing a patient, and then the science of it, of seeing someone, understanding the injury, coming to the right diagnosis. That's number one. Once you can get to the diagnosis, that will determine, okay, well, where are the limitations? What are the things you should or should not do? What are the things you can and cannot do? And how do we graduate you back into whatever it is that you do want to do? And that takes a proper assessment to do that. In general, what I sort of will tell people is you've got to listen to your body, right? You just said something there at the end that's really important. When I do these things, it hurts. Well, your body's telling you, right? Like if something's bothering you when you're doing it, you've got to listen to your body. And if it's in pain as a result of doing that thing, then it's likely not beneficial. Now, in terms of how you can modify that, should you stop doing it completely, that's the more specific of it, where you need that proper one-on-one interaction to really go through a proper diagnosis and then determine what the plan of management is.
All right. It doesn't, basically it hurts most of the time, so it doesn't hurt exceedingly more. I just wondered if you thought I might be doing more damage by biking and walking.
Hard to say. In general, knee injuries are better with like low-level cycling, number one, than walking. So that's sort of a general rule. But again, it does also depend on the individual and what the exact injury is.
Linda, appreciate the call. We got to run for another show, but you want to have a further chat, which sounds like you might want to do that with Dr. Lou. Always advise, Linda, the number, and for you as well, 1-855-55 Lou, DRLOU. Email is info@pinpointhealth.ca, and simply pinpointhealth.ca to reach one of many clinics around the province and otherwise, and always growing as well, open and ready to serve and get you back on the path to good health. We'll catch you next time. Pinpoint Health Show, Global News Radio.
The preceding program is a specialty program. Unless otherwise identified, the participants on the program are not employees of Chorus Entertainment. Opinions expressed may not necessarily reflect the views and policies of Global News Radio 640 Toronto.